stage Andrew Lacy, of CEO of Prenuvo, and Dr. Prickett of Concierge Medicine of Boca, Raton.
Good afternoon, everyone. I think by now we probably all know why we're here and what we want to achieve. So let's dive into what we can do now to improve our longevity and the potential of having a good health span, the number of years that we remain well and active and free of those diseases that may well inevitably come and get us. But we want to try to avoid that for as long as possible. Very brief introduction. My name is Peter Bowes. I'm a journalist. Been a journalist for some 40 years now. Most of that time with the BBC, 36 years in the UK, and now here in Los Angeles. I have a podcast which is called Livelong and Master Aging. Been doing that for about 7 years to go to really do a deep dive into some of the issues that we've been talking about today, and that's what brings me to this event. Caitlin.
Hi, I'm Dr. Prickett. I'm a board-certified internal medicine and concierge physician and founder of Concierge Medicine of Boca, Raton.
And Andrew.
Hi, I'm Andrew Lacy. I'm CEO and founder of Prenuvo. I'm a serial entrepreneur who had a midlife crisis in his 40s and partnered with a bunch of MRI physicists to answer the question, am I okay?
Excellent. So 24 years ago, I had a full body scan. They were just becoming a thing then, in the late 1990s, year 2000 I had mine. It was a CT scan. I'm going to talk about MRI scans today and we'll explain the difference. And at the time I was told that I was a pretty healthy 38-year-old, apart from one thing. They found a not too small stone in one of my kidneys. Turned out to be a calcium oxalate kidney stone. I was told that maybe at one point in the future I would wake up with the sensation of being kicked in the side by a mule, and that at least I would know what was happening, that the kidney stone was on the move. And that actually happened about 14 years later. At the same time as I had my scan, there was a woman police officer from Los Angeles, a captain of the LAPD. She had the same scan, she had no symptoms, and they found a cancerous tumor in her kidney, and she thankfully had successful surgery to remove it. So, should we all be having full body scans? Are they worth it? Are they worth the money? Are they worth the possibility of getting what are called false positives, where they spot something, it needs a lot more testing to determine what it is, expensive testing potentially, and also potentially the anxiety and the worry that you might be carrying something that could cause you a problem in the future. So, Andrew, explain what you do with your company, maybe how MRIs differ from this kind of scan that I had.
Well, it's hard to do it succinctly, but let me try. So, the scan that you got was a CT scan.
Correct.
The CT is a spinning X-ray, which is very good at, like all X-rays, seeing bones, but perhaps not so good at resolving fine details in soft tissue, our organs. MRI is different. MRI, we excite the hydrogen in the body, and depending on how we're trying to excite it and how we listen to the signal that comes back, we're able to look at our bodies in 3 dimensions. We call them voxels, and we can filter for different tissue weights, blood, protein, fat, fluid, and so on. And we can almost do, these days, in vivo histology of those 3-dimensional voxels to really understand what's going on.
Caitlin, this is something you recommend to all of your patients?
For the majority of my patients, yes. My patients are very proactive about their health and really take their health seriously. And so when you go to your physician, you get your physical exam and your blood work, and everything may come back normal, but there may be something brewing underneath the surface. There may be something that's asymptomatic, that's not showing up on a blood test or a physical exam. And with these whole body MRIs, we're really able to take a look beneath the skin and see if there's anything that we need to address now, as opposed to waiting until it becomes an issue later on.
Andrew, just give me an idea of how many scans you do and what percentage actually reveals something that is potentially life-threatening, as opposed to something that maybe just needs to be monitored over the coming years and isn't potentially that serious. What proportion comes out as something that you need to take action immediately?
Yeah, so we like to think that there are really 3 outcomes from the scan. The first outcome are potentially life-saving diagnoses or findings, and these tend to be cancer, solid tumors somewhere in the body, or aneurysm, which we can get in the brains, aortic aneurysms, abdominal aneurysms, and a bunch of other places. And we find those in around 1 in 25 people. That's the first category. The second category are moderate to severe findings that are typically the early stages of what might one day become symptomatic chronic disease. And we see those, for example, in the liver or the spine, and around 15% of people have those findings, so 1 in 6 to 1 in 7. And then the last category are the vast majority of people, which when we screen them, we more or less are able to give them a clean bill of health, and what they receive is peace of mind.
So what about the criticism? You only need to Google full body scans and you will see that there are countless doctors, experts, radiologists, medical organizations in this country and around the world who will say, bluntly, they're not worth the money. That as a population-wide scanning procedure, as a device, that they're simply not worth it because of the false positives, because of the cost of following up things that might be found that ultimately the patient doesn't need to worry about. Why is there such this huge gulf between what it seems most of the medical profession believe and what you're actually selling to patients?
Well, I think the starting point really is to pass what a lot of these experts are saying, which is typically, there's not enough evidence yet for us to evaluate whether these are appropriate interventions at a population scale. And that's reasonable because it takes time to collect that evidence at population scale. In fact, the few preventive health tests that we have today, like mammogram or pap smear tests, they took 20 or 30 years actually for that evidence to be collected for them eventually to be standard of care. So that's understood. So then the question is, well, what do you do in the meantime? All of us, as folks that are interested in longevity, what do we do while we wait for that evidence? And as a company, of scientists and MRI physicists, we're working really hard to build what we believe is the most accurate version of that scan. We've been doing it now for 15 years. We've been studying it clinically for now 3 or 4 years. We're in the process of putting together evidence to publish it. But directionally, we believe that these scans are a lot more accurate than the scan that you may have got 20 or 30 years ago. And eventually, these will have accuracy similar to the current screening that we have now that's standard of care.
Okay, good. In terms of the process, so one of your patients will have the scan, you will get the results,
Yes.
and you'll discuss it with the patient.
Right.
What sort of level of counselling goes into that process? And I'm thinking of, and I've mentioned the stress and the concern and the worry that the results may have on a patient, that perhaps even with hindsight, they might think, well, I don't know whether it was actually worth it. So, big picture, how do you deal with that?
Sure. So with each of my patients who I recommend the whole body MRI scans to, we have a thorough discussion about what are we going to do with the findings when they come in their report. And so I always talk to patients that the scan's always going to show something, albeit likely minor, but it's going to show something. And what are we going to do with those findings? And so I always prioritize with patients with the findings. We're going to prioritize what we need to be concerned about now, what we can know that you have and maybe follow up in a year. And then the third way, whatever benign findings or minor findings, just something that we know is there and we move on. And so I discuss that before even signing the patient up for the scan. And then I get the report actually before the patients do, so that me, as their primary care physician, is really able to review and make sure there's nothing major that I need to, quote unquote, break the news to the patient about, as opposed to the patient finding out by reading their scan themselves, because they already have this inherent trust in me as their primary care physician, so I'm the one that's going to discuss any major findings with them. Then we sit down, we go through the scan together, the patients love looking at their pictures and images and inside their bodies, and then we do that triage of prioritizing the results.
I think I would add to this, we have a healthcare system that's very reactive. And one of the consequences of a reactive healthcare system is that it creates a lot of anxiety about learning things about our health, because a cancer diagnosis in this reactive healthcare system is automatically a horrible, life-changing thing. Where we've found cancer, over 90% of the time it's stage 1 and still localized to the organ of origin. So I like to think we're in some ways in the sort of peace of mind business. We're trying to change the definition of disease to something that's not scary, in fact something that's empowering.
Yes.
And you know, I think that's the sort of health system that we all desire to have, which is focused on preventative health and precision medicine.
Yeah.
How do you justify the cost to patients, $2,500 for a scan, and potentially more expense if you need to do follow-up procedures? And also coupled with that, the insurance companies are not even close to covering these kinds of scans yet, are they?
No, health insurance company nowadays is more focused on sick care than health care, and there are very few screenings that, just like Andrew mentioned, you know, breast cancer screening, cervical cancer, prostate, colon cancer, and sometimes lung cancer screenings, but there are many other cancers out there that we don't screen for, and it's important for patients to go out there and have these kind of direct-to-consumer offerings where they can be proactive and go out there and look for things themselves. And so I think mentioning the cost, I think with the cost, it's well worth it. I mean, you look at your high deductible insurance plan, you may have to pay $6,000 before your insurance even kicks in. And so to be able to have your entire body scanned, not just to find stage 1, stage 2 cancers or aneurysms, but maybe things like fatty liver or things that you can take action now to prevent further progression, I think it's well worth the price.
It was David Sinclair earlier said he wants to help everyone in the world in terms of their health and longevity. To be blunt about it, this is a preventative procedure for the rich at the moment. Andrew?
I mean, I don't know. I think there's, if I could challenge that for a second, I think it's an assumption that someone in the rich, they care about their health. And I think we have a lot of people here in Florida and around the country that are starting to believe that the health system is there if they get sick, but is not there to keep them healthy. And there's a desire for people to take that into their own hands. And as a company, we're working hard to bring the cost down and make these tests more scalable and accessible to folks. But there's a tremendous cost to late diagnosis. There's a tremendous human cost. And the goal really here is to be able to identify, for example, chronic disease so early that you don't even need to access the medical system down the track. You can just make lifestyle modifications and you never arrive at a symptomatic sort of chronic disease.
Just one question away from the financial side. A full body scan, is the scan of the entire body, presumably encompassing every organ in the body, is that as good as a smaller scan where you might be focused on the abdomen or a particular organ? In terms of the results, is it as accurate? Is it as likely to find everything potentially that it's capable as a more specific scan?
So for screening purposes, we believe it is. The only difference between the screening we do and some of the single body part scans that people do is we don't use contrast. Now, for single body part scans, we use contrast to look for vascularity that, you know, typically is promoted by tumors. With Prenuvo and the screening we do, we have a special sequence that looks for hardness. And what we know as it relates to cancer is, well, not all women are told to feel their breast lumps. The reason for that is, although not all lumps are cancer, all cancer are lumps. And so we're able to do that now digitally at tremendous resolution everywhere in the body.
We are sadly out of time already. I'm just going to leave you with one thought. The police officer that I mentioned earlier who had the scan the same time as me, they found a cancerous tumour. And so she successfully had it removed. And I put it to her that these scans are quite controversial. Same issues applied then as they do now. And she said, well, there's nothing controversial in my mind. It's saving my life. On that, thank you both very much.